What do you think people should be aware of if they were going to start a course of psychodynamic therapy? What should the patient know going in?
Oh, that is such a good question. What should they be aware of going in? I think they need to know about the timeframes. So not only is the therapy itself going to last a long time, but actually they might not see the benefits straight away, or even for quite some time after the therapy ends. I think they should know that the therapist can't wave a magic wand. And it's not that you go to the therapist, you kind of bare your soul, and then the therapist makes you better. I would love it to work like that, but it really doesn't. So the change comes from the patient. It's the patient doing the work. The psychotherapist is there to help and support and to sort of guide at times. But psychotherapy is really hard work. It's not a sort of an easy alternative to taking medication or whatever other treatment there might be. It's a grueling, energy-sapping, disruptive process, and people can often feel worse before they get better.
Because really, you're taking a look at the way the patient's thought and behaved for their entire life up until this moment, and you start to pick that apart.
Yeah, and often the bits that you end up sort of dwelling on, the useful bits to think about, are the very bits that the patient has been trying really hard not to think about for years. We were speaking about defences earlier, so you're taking all of the really sort of sensitive, raw, vulnerable bits of the mind and starting to look at them, and it can be horrific.
What kind of reactions can people have?
Everyone reacts in different ways, really. People can feel sort of more depressed. They can feel overwhelmed. They can feel angry. They can feel frustrated. Almost sort of any feeling can be produced, I guess.
And their initial symptoms can worsen in the first part of therapy, can't they?
They definitely can, yeah. And not even just the symptoms they have, but it might be that somebody wasn't actually feeling depressed when they started therapy, but they came for a different reason. But actually being confronted with some of this stuff can result in them feeling very sort of low in mood, or that they're sort of feeling very overwhelmed. So it's, at the same time, I don't want to sort of overstate, but equally I don't want to understate the sort of effects of going through therapy. It's a powerful intervention. It's certainly no less powerful than medication, say. And just as medication can come with side effects, psychotherapy can definitely come with side effects, and that has to be acknowledged. Just as with medication, it's no good just ignoring the side effects and hoping they'll go away. They have to be given some thought and consideration.